Now let's examine the 40 series of premolar teeth. First, let's look at parallel alignment for tooth number 40. We'll start with the occlusal prep on tooth number 44. This is parallel alignment, grasping mode. The chair position is a semi-supine position, as used for tooth number 42, with the patient's gaze directed towards the upper front of the ceiling and their head gently inclined. Slightly rotating the patient's head to the right helps with visibility. The operator is at the 12 o'clock position to achieve parallel alignment with tooth number 44's axis. Their feet are spread wide and the foot pedal is situated on the right. The back and neck are within a normal range. However, it's worth noting that, unlike the parallel alignment for the 20 series, the operator's body doesn't necessarily need to be pressed too closely against the patient's head. You don't need to be far away, but maintaining a moderate, appropriate distance is often more advantageous for visibility in the 40's posterior region. Rest the left hand's fourth and fifth fingers on the zygoma and the right hand's fourth finger on the mentum. When grasping the suction tube with your left hand, bend it inward. But don't bend it at a sharp angle like you would for the corner of the mouth. Instead, create a relatively gentle curve. In that position, you'll place the tip of the suction tube between the lingual surface of tooth number 44 and the tongue, ensuring optimal positioning for the procedure. This suctions water and saliva while also providing tongue protection, so, the burr doesn't scrape the tongue's soft tissue. The handpiece's entry angle must be perpendicular to the plane formed by the oral orifice, ensuring a precise approach. And approach the occlusal surface with the burr from the palatal aspect. During prep stroking, when pausing for a moment, as illustrated in this image, gently insert the suction tip into the right retromolar pad to effectively aspirate any residual fluid. Let's review it. When you pause, your right and left hands switch roles. Now, let's look at the prep for the buccal surface of tooth 44. I'll skip the parts that are the same as the occlusal surface prep and focus on what's different. First, to get a clear view of the buccal surface, the patient's head is rotated slightly to the left, unlike before when it was turned to the right. Similarly, to ensure a clear view of the buccal surface, the operator's neck is slightly laterally flexed to the right. The fourth and fifth fingers of the left hand secure their rest from the zygoma, and simultaneously, the fourth finger of the right hand obtains its rest from the masseter. For tongue protection, unlike before, when preparing the buccal surface, the tongue is automatically shielded by the structure of tooth number 44. Therefore, there's no need to place the suction tip between the tongue and the lingual surface. Instead, the bulk of the suction tip and suction tube is strategically placed to assist in securing a clear view of the buccal surface and establishing sufficient handpiece space in this manner. I insert the instrument along the right vestibule, which then also serves the purpose of retraction. Now let's look at the mesial and distal prep on the buccal side of tooth number 44. To achieve sufficient visibility for the distal surface of tooth number 44, it is best to completely turn the patient's head to the left. In addition to this, the operator's neck is also strongly bent in a right lateral flexion. However, excessive flexion can stress the musculoskeletal system, so it's advisable to perform it intermittently rather than maintaining the same posture for extended periods. If this method proves too demanding, consider attempting a perpendicular alignment rather than a parallel alignment. If you visualize it, with a perpendicular alignment, it becomes easier to obtain a clear view of this distal surface. Therefore, you can anticipate maintaining a more stable posture throughout the procedure. The fourth and fifth fingers of the left hand rest on the masseter, and the fourth finger of the right hand rests on the right masseter. The suction setup and the axis of the handpiece are identical to the prior buccal surface preparation. Let's examine tooth 44's lingual prep. To ensure a clear view of the lingual surface, rotate the patient's head far to the right. The lingual prep provides a surprisingly good line of sight, so no particular neck flexion is needed for the operator. For the lingual surface, the position of the suction tip is important. For tongue protection, it's placed between the tooth, the burr, and the tongue. The secondary bend of the suction tip should be angled slightly outward to make it easier to insert between the tongue and the tooth. The initial bend in the suction tube should not be abrupt, as if for hooking, but rather a gradual curve. This gentle bending allows for a more suitable and comfortable grasping by the left hand. Let's look at the prep for the mesial and distal surfaces from the lingual side of tooth number 44. For optimal visualization of the distal and linguodistal aspects, the patient's head needs to be rotated maximally towards the right. Similarly, the operator will also do a slight lateral flexion to the left with their neck. During the buccal surface preparation, the fourth finger of my right hand rested on the masseter region. However, as the handpiece head shifts from the buccal surface to the lingual surface, resting it on the masseter becomes difficult due to the increased distance, requiring a longer grip on the handpiece, which creates an uncomfortable feeling. So, when doing a prep on the lingual surface, I prefer to place my right fourth finger on the 40's premolar area. When the burr of the handpiece is working on the lingual surface, protecting the tongue is very important, so the suction tip is placed between the tongue and the burr. Just this alone is enough to suction a significant amount of water and saliva right into this suction tip. However, any water that escapes and gathers in the oral cavity is intermittently aspirated. This is achieved by transferring the left-hand suction tube to the retromolar pad area, strategically repositioning it during the intervals when the burr momentarily pauses its stroking preparation.